to the South East Wales branch first webinar. We've got Ross Barrow and Lawrence Ambrose. So if they can introduce themselves, we'll get started. Do you want to go first, Ross?
Yeah, sure. Hi, everyone. I'm Ross Barrow, Policy Public Affairs Officer at the College of Podiatry, covering Wales.
Hi, I'm Lawrence Ambrose. I'm the Head of Policy and Public Affairs at the College of Podiatry, covering the UK. So I manage Ross and I ensure that what we do in Wales, we have a similar overview within Scotland, Northern Ireland, and England. As much as we can.
So, what is actually your job? What is the policy officer's job? What do you do from day to day for podiatry in Wales?
So a number of things. So as Policy Public Affairs Officer in Wales, my responsibilities are quite varied. The first of which would be liaising with key stakeholders in Wales. So that includes Welsh Government, the Welsh policy officers for some of the allied health professions, Health Education and Improvement Wales, and we've been doing some work with them recently that we'll touch on in the interview, Public Health Wales, the provider Cardiff Metropolitan University, the link for the college with all of the political parties in the Welsh Assembly or now Parliament, and also the link person for the Minister for Health and Social Services, and also the Chief Allied Health Professions Officer in Wales, who's the kind of the highest ranking civil servant in terms of looking after the AHPs and therapy brief within Wales. And through all that work and engagement, a lot of that is about face-to-face meetings, but we've been doing a lot on Zoom recently because of the COVID situation. And there's also a lot of responding to government consultations or things that come through from HIW, mostly on the NHS health and social care workforce. So we're trying to position where we think podiatry is best placed, so what's going well in Wales at the moment, and what is our vision for podiatry in the next 10, 20, 30 years, and how do we work on that. And then I suppose there's also a piece in my role as part of the wider policy and public affairs team in drafting some policy documents. We just
missed that. We just missed that last bit there. You just cut out for a second then.
Sorry, Dave. Sorry. Yeah. So there's a role for me in terms of drafting some of our policy documents. So I'll work with Lawrence and Julie as part of the wider policy and public affairs team. And examples of that are things like the role of podiatry and rehabilitation. So that's a key one for us at the moment in terms of what's been going on with COVID. So what's our role specifically in helping people who have had COVID, but also some of those people who might have had effects of COVID, but not necessarily had it directly. So we're thinking about people that have been shielding, people that haven't accessed podiatry services, whether that's in the NHS or in independent practice over the last few months. And then once those documents are produced, it's about how do we engage the various stakeholders that I've just mentioned in that process, and a key one for us there is Welsh Government.
Yeah. So I can see how the NHS get information to you, and there's a lot of NHS members of our branch, but there's also private practice members. How do we get information to you? I know we used to have the Wales Forum, which hasn't met for a long time. And I think with Zoom meetings and everything now, that will be a very easy thing. I can't see us ever going up to anywhere, or I can't see me ever going to London for a meeting again, because I don't see the point of it when this is done so easily. You know.
Yeah.
Is there any plans for the Wales Forum to get up and running again, or?
So no is the simple answer to that. But I think in terms of to answer the question, I think that it's really about two-way communication. So in terms of the communication that I would provide to all podiatrists in Wales, no matter what sector they were in, whether it was NHS, independent or higher education institutions, you'll have seen various policy and public affairs updates that are posted, and they go out around about on a quarterly basis. Yeah. And they try to cover the main ground in terms of what I personally have been working on in Wales, but also what are the kind of key strategic priorities for the college. So we started doing that around kind of 6 months ago now. I think you had your last update at the start of the year. Yeah. And then obviously with the whole COVID-19 situation, that's moved to kind of having daily and then weekly updates from the college. And we fed into those kind of the Welsh items as appropriate. So So that's in terms of making you aware of the information that you need to have, so that you know how best to kind of feed into those work streams. So that's the first thing I would say. And I'm always very happy to receive emails and telephone calls for any member in Wales with any kind of policy suggestions or ideas or questions about things that are happening at the moment. And that's always something that we're really encouraging. But in terms of beyond those updates, there are also other areas such as the Welsh Independent Practice rep. I think that's yourself, David.
That's me.
Isn't it?
That's me.
Actually,
Yeah.
hello. Through the group that the college has centrally. So we have a committee structure which involves independent practice, HEIs, and also the NHS. That all feeds in, as you know, to the college and council, and then we kind of derive our work streams from that. So that's one way that we receive intelligence back. But I couldn't stress enough the importance of that continued two-way communication, and there can be no much communication. You know, we need to kind of keep that going as much as possible. I know it was a shame that I didn't get to meet you all at the conference in March, but
hopefully next year.
Yes, very much looking forward to being there next year, and you know, providing, you know, not just everyone who sees this hopefully, but more members with an opportunity to not ask questions, but also to kind of hear what's been happening in Wales recently.
I do have to say, I think the college have done a brilliant job in lockdown, and I think it's made the communication easier, because as independent practice rep, I haven't really had much to do up until coronavirus, and people now have been contacting me on our WhatsApp group, and it's actually in some ways it's made the communications better with you. It's a strange thing that's happened in this crisis, but I think it has made things easier. People are more aware of looking on the college website now, which is something they weren't doing before, and the updates have been brilliant. So that's been a really good thing. So we got a lot of these questions. Now we might be joined by someone else later on, Steve, when he finishes work. But so I'm going to leave his question because he wanted to ask that one. So what we were going to look at, I was going to look at first, was the ones about if you were a student wanting to study podiatry and work in the NHS, what are the opportunities in Wales now? I mean, it's quite difficult now to say what they're going to be in this new world, because we don't know what they're going to be. But as far as you know, what can you tell us about that?
Yeah, well, the first thing to say, Dave, is that, you know, being a student who's interested in potentially studying podiatry in Wales is very exciting in Wales specifically, because of the bursary scheme that's available through HEIW Welsh Government. And actually, if you look at what's available in the context of the UK, that is a really good opportunity for someone to get into training. And those bursaries are there, which provide funding not just for tuition fees, but also there's a maintenance grant, and some of that is means assessed. But it's a really good system, and it's not something that students have got access to in all areas of the UK. So I would really want to highlight that to anyone, not just people who are already podiatrists, but if you're talking to people, or younger people, or mature students who might be thinking about the profession, actually, if you're based in Wales, you know, from the offset, you've got a really good opportunity. I think the question was around opportunities in the NHS, and I think that the first thing to say on that is that if you have the bursary in Wales, HEIW operate a golden handcuff system whereby they ask you, can you work within the NHS for the first 2 years upon graduation? That's obviously because they're keen to get the kind of workforce numbers in the NHS maintained. But that's a really good opportunity for people to kind of try and find their feet, I suppose, at the start of their career. So there's a lot of kind of training opportunities that are available through the NHS. There's a lot of opportunities to get involved with the different teams, and you know, I don't need to tell you about all the specialisms in podiatry, you know, MSK, diabetes, you know, the rest of it. So if you're interested in any of that, you can do it. I think it's also fair to say that through our discussions with Health Education Improvement Wales, although the bursary does have the NHS kind of 2-year kind of golden handcuff system, which actually doesn't operate in any other part of the UK, it's only just Wales. They are very keen and understand the role of independent practice as a really important part of that ecosystem. And that's something that Welsh Government really understands and gets. So when, for example, we're having conversations on the workforce and where people want to be, where people want to be training, it's very much something that we are promoting to Welsh Government, that actually we need people in the community in independent practice, and we need people in the NHS in the various specialisms. So to go back to the question, it's a really good opportunity for potential students in Wales at the moment. And I suppose it's just, how do you find your feet within those first 2 years, and then at the end of the first 2 years, hopefully you find your specialism. There's also a career development framework that is soon to be launched at the college. So that's around, how do you go from one stage to the next? So obviously you'll come out as a band 5 podiatrist. So if you're looking at kind of band 6 within the NHS, what are the stages and what are the steps you need to do to get, to kind of the next level, really.
Has the Golden Handcuffs, has the first cohort of that started yet, or are they working, or is it this year's cohort?
No, it's been working for a number of years, actually. I've got to say, it's not been working, and this is well documented. It's not been working well as it possibly could do, and for that reason, Welsh Government have really set up a working group to look at how do you actually make a golden handcuff system work. Because I think what they were finding was that students were graduating and then choosing maybe to go abroad or to do other bits and pieces, and actually NHS managers on the ground were wondering where these graduates were. That's not all of them, but I think it's fair to say that it's been quite operationally complex in terms of how do you actually nail that down. But the good thing is that we've got Alan on that group who knows both sectors inside out, and is in a really good position to advise on the way forward with that.
Because obviously when you're saying about students in private practice as well, because I take students on placement, normally in an emergency when they can't find, or they can't get to where they've got to go. But I think it's really good, and I've managed to get, obviously selfishly, I've managed to get associates from it, and so there's been work that way from it. But I think that's something we should try and encourage people to do, is to take students if there aren't enough places. But I think it's something that they should be doing, that should be encouraged by the college, that they do get more independent practitioners to take students, because some of them are a bit reticent to do it, I think, but it is really worthwhile.
Yeah, 100%. And we've just had our annual engagement process with HEIW, and we were talking about the role of the independent practice and the NHS, and actually it was a point that they were making on our behalf, which was actually we need to be seeing a multitude of placements. We were also talking about the geography, which is maybe something we'll touch on in the interview in terms of where you do your training. But it's really, really important that by the time people come out and the graduates, they know about the independent sector and they know about the NHS, and then they can really make an informed choice about where they want to go with a career.
There's another one here. I think it's pretty much, we've covered it really, but what opportunities are there to specialise in podiatry in Wales? I think we know there's lots.
Yeah.
But the other question on there was about the scope of private practice and how it's expanded over the years. And the question was, do we think the college has done enough to promote the private sector and the range of services we can now provide, and what can they do to do that?
Yeah, sure. So I think the first thing to say is that what the college does in terms of promotion, and my role's split into kind of policy and public affairs, and this very much comes under the public affairs sphere of how do we firstly, how do we encourage the public to know more about podiatry? Does everyone really know what podiatry is? Do people know the range within podiatry, all the various specialisms that you all know about? And I think that's an ongoing process, and I think that's something that we just need to keep doing. It's really, really important, and not only the public, but also politicians, other healthcare professionals. That's a really, really important part of our engagement process. I think there are a few things that the college could do around independent practice, and I think one of the things I'd highlight is the role of the professional officers within the college. So we're blessed within the college to have a really good professional practice team who specifically provide guidance to independent practitioners on on practice management and everything to do with how you should be running your practice, and clinical guidance, etc. So they're always on hand with questions, and if anyone needs their email address, we can pass those details on, because it's really, really helpful advice. But I think and I think actually due to the kind of the COVID-19 situation, that's really come to the fore in terms of, you know, I think it's left a lot of people in independent practice thinking, well, you know, what really should we be doing in this situation that's so unique, and we haven't really faced this before. And there's been a lot of challenges around what government has been saying in terms of what should be open and closed, and advice about maybe you should always have your practice open and available. Perhaps you should only be seeing some patients, and you might be seeing some patients by remote consultation. And for a lot of people, that's been a very new process. So I think there's a lot of materials that the college has produced for independent practitioners, and that's something that could really go on. And if there's any independent practitioners watching this, it'd be really, really good if you could kind of link to some of the stuff that's on our public-facing side of the website. Not only so, you know, people that are interested in your practice will see that, but that also has a benefit to the wider public in terms of being able to see those messages that are coming through. But yeah, I think it's an absolutely ongoing process. And I think in terms of our engagement with government, I think, and we've already touched on this, what we really need to do as a college and what we will continue to do is champion the independent sector alongside the NHS and make sure that we're saying, you know, it's not one or the other, it's actually both. And the only way that we're going to, you know, be able to, you know, get things done is by working together in partnership. And I know that's something, Dave, that you've been talking about, you know, through Alan Wood and the Private Practice Network. Similarly, we've had discussions through the Public Sector Leaders Network at the college. There's a lot of work to do, and I know it's already been done by us within the college and members to bring those two groups together. And I think the experience of COVID, where you've had people redeploying into other areas, has been really helpful. And actually, it's been helpful in terms of other healthcare professionals, not necessarily within podiatry, seeing the kind of the value of the profession as well. So yeah, there's a lot going on, and a lot to do. Yeah.
I think we do really need to inform the public, because sadly, I've had the most number of calls in lockdown since Boris mentioned hairdressers 2-3 days ago, and then as soon as he mentioned hairdressers, my phone started ringing because people are still confused about what we do. You know, it's a sad thing, but people still, oh, have you been open all the time? I didn't realize you've been open. I didn't realize are you classed as health? Which is that's been a fun one to field. Yeah, I think we do this. I don't know how you do it, because we're quite a small profession. We can't do massive TV ads or anything like that to inform patients. It is down to individuals really, as well as the college, to make sure that they do as much as they can. So
David,
yeah?
Sorry, can I just come in on that one?
Yeah, sure.
We did actually have a TV ad through the Department of Health. It came out just before COVID hit. Yeah. So it just slid down the wall and got completely missed.
I didn't realise that. That would have been good, because I think it is quite hard for us to do big things like that. I know there's not, you know, it's an expensive thing. But people have said, you know, we haven't been mentioned on the telly, because, you know, we haven't been mentioned on any of the, you know, they've mentioned opticians, they've mentioned dentistry, but they haven't mentioned us. I've even heard physio mentioned. I have heard podiatry mentioned a couple of times, but you know, that's what people were waiting for, to get the nod that they could come and have their feet done. But you know, that's where we are. Now this is quite a this one question is always quite a difficult one, and it always comes up about FHPs and the unregistered sector. There's areas of the country, not so much in Cardiff, but certainly in the valleys areas, where colleagues feel they face unfair competition from the unregistered sector. And some people can start up after, you know, a couple of days, couple of weeks of training. And again, it's about informing the public. How can we inform the public of who they should be visiting? This comes up all the time. I don't know what your thoughts are on that.
Yeah, I mean, I think it's a really good follow-on to the last question we were talking about, you know, do people appreciate the level of skill within, you know, the podiatry profession and the range of things that we do? And I think if we can answer that question, this question becomes a lot easier. And I think they're actually part of the same piece. Yeah. There's a couple of things to say on this. The first thing to say is, as a podiatrist, and again, I don't need to tell you this, you've got a unique set of skills which you can bring to market. So you know, it's about how that is done, and again, it's back to the communication of how do you make the public aware of that. And I think you're quite fair and right, Dave, in what you're saying. There's a role for the college there, and there's a role for our members there as well, and we've got to do that in partnership. Again, I would highlight the professional officers guidance. I think, in terms of the guidance that comes from the college, in terms of if you've got any questions around independent practice and what you could be offering, or what you should be offering, or how, how it's marketed, anything like that. Those are questions that, we can chat about, we can discuss. There might be opportunities through social media, perhaps, that we haven't thought about. There might be new opportunities that come around as a result of, COVID-19. Everyone's working in different ways. A lot of things have gone digital. A lot of practices have had to think really, really carefully about how do they maintain essentially the client base, because they're not seeing customers perhaps as much as they were. And what are some ways of doing that? And I know there's been some really good engagement through, Zoom meetings like this, and check-ins with customers.
I've done a few of those. Yeah.
The people have found quite helpful. And I think it's about exploiting some of those opportunities to bring a longer-term benefit for patient care, and making sure we're all heading in that direction.
Yeah, I think what people would like, obviously, they'd like to see the closed profession, but that's not something that the college can lobby for it. But that's all they can do, really. We can't make that happen and stop the unregistered sector, which is what a lot of colleagues would like. But it's just not something that I don't think is possible at the moment, or the will to do it. I don't know.
David, there is some work going on to standardise the education of FHPs, and I think if we could do that, and they were all working at the same similar standard to assistant practitioners, and we could have them working as assistant practitioners rather than autonomously, it would be the ideal world. I mean, we've lobbied the Professional Standards Authority really, really hard over the years. Yeah. We've just end up hitting our heads against a brick wall. It's not that it's a continual fight we're having.
I've been in practice 30 years. This has been going on for 30 years since I've been in practice and before. So it's nothing new, is it? I don't think Steve is joining us, so I'll get on to his question. So podiatry is classed by the masses as not glamorous professional choice. Would school screening of potential foot and lower leg problems invigorate the profession by improving the public viewers and generate interest in future podiatry careers, whilst improving the foot health of our future generations? Now, this has come about because there's a couple of current podiatrists who qualified recently who were doing the job because they went to a podiatrist when they were young. So it's something that we've always talked about, is screening in schools, but it's something that doesn't happen because the outcomes happen maybe 50 years down the line. So governments are not always terribly interested in them. But what are your thoughts on that?
Yeah, well, we know from the figures that come through that the most likely reason why someone will think about podiatry and apply to podiatry course is because they know a podiatrist or because they have been seen, by a podiatrist. And I think that's, it's a fair reason why, potentially you get more mature students in podiatry than for some of the other allied health professions. So I think this is a really, really key question. Probably the most important question we can talk about is how do we sustain and ensure that we get the next generation of podiatrists coming through. I would highlight that in terms of our strategic priorities as a college, you'll have seen the 5 pillars of strategy. I'm sure everyone's seen that. And one of those is workforce. So each of those pillars has equal weighting in terms of everything that the college does. In terms of so workforce is a really, really key priority for us. Again, the first thing I'd say is there's potentially a misconception, around podiatry, and how do people know exactly what podiatry is? And if more people knew about the opportunities within podiatry and the specialisms and some of those exciting areas as well, like forensics and sports science, and running on the sports field and all that kind of stuff, would that encourage more people potentially at a younger age to apply for the profession? And I think the answer to that is yes. In terms of actually podiatry screening in schools, that'd be really good because then school-age children are actually seeing podiatrists and they understand the role that they have. I know that this is something that happened in the past, but as a college, it's certainly something that we would support happening again. I suppose the question is, organisationally, how does that happen? So we would obviously need approval from the health boards and from local authorities in order for that to happen. But there are opportunities in terms of things that have been happening very, very recently, like the Welsh Government's obesity strategy that was published around a year ago now, but was something that the College of Podiatry fed into. And that was really around the role of MSK podiatry in terms of, you know, sports injuries and things like that. And how do we make sure that, you know, people are seeing podiatrists early enough? And it goes back to that kind of early intervention and prevention. There's also a policy position paper that the college have produced on MSK problems for children and young people. And I think this is somewhere where you could really kind of resonance with, you know, people that are coming through, because if you're a child in a rugby team or a football team at school, and suddenly you have to stop playing with your friends, and you know you're potentially excluded from your peer group because you've got an injury, if you're able to meet a podiatrist in a school setting who's able to help you overcome that, and then you're able to re-enter the sports arena, I think for a young person that's going to have a massive effect. So I agree with everything, the suggestion in the question that this is something that we should be doing. It's potentially something that we can look at in terms of how would that be organised. I think there's also a role for making careers advisors within school aware of so there'll be a careers advisor within every school. And if the careers advice is anything like the careers advice I got at school, it's potentially not very full in terms of all the professions that are there. And I've always said that if you can speak to the careers advisors and you can really give them 10-15 minutes solid information on the profession, I think that's going to really resonate, and that's really going to hopefully be passed on to children. So again, that how do you do that? I think there's within the college, in terms of what the college is doing, I know that a business case has recently gone to the clinical senate, and this is about supporting a new role within kind of having a wider children's strategy within the college, and by working with all the colleagues that work in this area to try and put their heads together on this. But it's a really key thing that we need to be doing. People in the college are working on it, but definitely if there's more opportunities to engage locally, I think we should be doing that. And the last thing I would say on that is that before lockdown, we wrote to all the football clubs that were based around podiatry schools. One of those was Newport FC. And Newport FC came back to us and said they would be very interested in holding a collaborative between Newport FC and all the young footballers that were hoping to make it in the game, and also retiring footballers who might be looking for a second career. So you're already talking to people who might already have some sort of interest in sports science, and that is something that's really encouraging. So we've not been able to have that meeting and that engagement because of lockdown, but that's something definitely that is on our radar, and both the college and Newport are really keen to move on. So we really hope that bears fruit when we can finally go there and have that discussion.
So that sounds really good. Because I was thinking with the you got this golden handcuffs for the students, and this screening would seem like an ideal opportunity to, if you're struggling to find roles. And if you've got, I don't know, over 2 years, 40 podiatrists who could take part, supported obviously by senior colleagues in doing that screening, because that would seem an ideal role for them to do, because I think it probably has been a struggle to find the roles for them as well. I don't know whether they've struggled to find the roles, because there's a lot of people, and there's never that many jobs advertised in Wales in a year. I don't think I don't see that many. So if you've got 20 podiatrists coming out each year, I don't know how many take the bursary, but somewhere around there. I've always wondered how they're going to manage to find the roles for these graduates. So that seems like a good something that they could be used for. I don't know.
It does, and it also goes in the direction of Welsh Government's health strategy. So you might have seen a Healthier Wales, which kind of underpins everything the Welsh Government's doing in terms of healthcare. And really the push on that is like everywhere else. It's about how do you take things from an acute secondary care environment and treat people closer to home, in the community, in primary care, and you directly, going into schools and seeing children, in their own environment, that's something that kind of really blends with that. I think there is a question about numbers and, how many schools are there versus how many podiatrists, and how would that all be organised? And I'm sure that would be a long organisational process. But, I still think that there's something there, and it should potentially could be explored.
Yeah, and there's obviously a role for the independent practitioners as well within that, because we're all over the country, so there is a role for that as well. The last question I think on here, we pretty much is a sort of a downbeat version of that one, saying that the clinical skills RS in an article in 2019 said that podiatry can't recruit students, then it's a failed profession, and there is no part of the podiatry skill set that cannot be delivered by other practitioners. I think we've really covered this, but what is the college doing about this, and how can we in Wales help with this? I think we have really probably covered that, really. But
I think, yeah, I mean, there's some points on, it kind of comes into two parts, doesn't it? I mean, I suppose the first part of the question is really pertinent, and it's something that, I think we're all aware of, and we need to get more people into the profession, and you can't deny that. And the numbers speak for themselves. So in terms of, we've gone out and got data on, what's the average age of podiatrists versus, some of the other AHPs. And you're looking at, the majority of podiatrists in that kind of 45 to 55 age bracket. And the question is, when a podiatrist is going to be thinking about retiring, and, you don't really know. So it's really, really important. And that's the discussions that, we as a college have been having with Health Education Improvement Wales, about when you're looking at the number of bursaries that are coming through, you actually have to look at the number of people that are, that are retiring, and you have to look at the age profile as well. So that's been an absolutely kind of key argument for us in that. I think it would be really helpful, actually, as part of that conversation, for all the members who are going to be watching this, HEIW are, I think I mentioned before that, that they're very keen to get data not only for, what's happening in the NHS in Wales, but also what's happening in independent practice. And if we can start to map out across the 4 regions of Wales what independent practitioners we have working, that would be really, really helpful in terms of providing some of that data around the demographic. So that's all the stuff that we can use in terms of lobbying material to say, that we need to be beefing up, the workforce in terms of who's coming in. So if we can make that plea, because that's something that we're already working on as a college in terms of trying to get that data across the UK. But if you would be able to help us in any way with that task, we would be extremely grateful. Yeah.
Brilliant. And we can put some links on and stuff at the end on the webinar at the end. So if you send us any links or anything that you want to send us, that would be great, and we'll put them on the webinar. But I don't think there's anything else we have to talk about now. So I think, well, thanks for coming on. And
David, can I just sorry, can I just say one thing? Yeah. We haven't had anyone from Wales on put themselves forward for council since Glenn Wallen stood down. So it would be great next time the council elections come, if somebody was to put themselves forward. Yeah. It would be great. We know we've got fantastic members in Wales.
Someone we can work on.
Great, thank you.
Someone we can work on. Well, thanks very much, and hopefully we'll do this again, possibly in person at the conference. But if not, we might do this again via remote link. Brilliant.
That'd be great. Either way, thanks, Dave. Cheers.
Thanks. Cheers.
Thanks, Dave.